Thank you, sir. It's always a pleasure to come to this beautiful hall. I'll be speaking on the burden of HCC in India, the present and the future. Liver cancer is the sixth most commonly diagnosed cancer and the third most common cause of cancer-related deaths. The problem with us is that the cancer registries in India do not provide us an accurate estimate of its prevalence. These are mainly urban in location, and the information is coming from cytology, oncology sites, municipal registration of death. Unfortunately, we are diagnosing HCC more often by radiology rather than by histology. And it's being diagnosed and treated by gastroenterologists, and it's not really going into the cancer registers. And so we don't have adequately correct data. This was a lovely review, which was by Dr. Subrat Acharya in 2014, which summarized the epidemiology of HCC in India. The last published registry data by ICMR was by this registry site in 2008. And I took it upon myself to look to see if this was further updated. But to my horror, when I opened the website, it gave me this recipe of aloo parotha in Hindi. This is just to summarize where our data is and how it is being propagated and updated. In 1998, Dheer and Mohandas published the autopsy data of HCC in India, and they found that about 0.2 to 1.9% of autopsy cases had HCC, and the prevalence of HCC was higher in southern states of India. This is a cancer registry data which was available from all the various centers. The HCC prevalence is about 3 to 5 per 100,000 population annually, which translates to 30,000 to 50,000 HCC cases occurring in India per year. And this was 2014 data. So the age-adjusted incidence ratio ranges about 0.7 to 7.5 for women and 0.2 to 2.2 per 100,000 population per year. And in Indians, the cirrhotics, the prevalence incidence of HCC would be about 1.6%, and dominantly it's a male disease with 4 to 1 ratio, male to female ratio. And the age relevant presentation is 40 to 70 years. There are regional differences in HCC burden in India, and the southern India is higher. Also, the northeastern states are higher. However, we don't have any prospective studies which are properly designed, and we don't have adequate data coming in from various centers. And these are mainly data from large centers and hence not appropriate. How do we look at the projection of future burden of HCC? If in 1998, 10,000 HCC cases were reported. In 2002, this became about 13,000. In 2009, it became 25,000. So either the prevalence of HCC was increasing or we were diagnosing it much more often. This was data which is from AIMS, from one solitary center. And if you see from 1990 and 1991, where they just diagnosed about 3 to 7% cases, they've gone up to more than 100 cases in 2010, 2012. This was in 2020, there was a global burden of cancers, out of which they took out the burden of liver cancers. This is the GlobCan studies. About 90,000 people were diagnosed to have liver cancer in 2020, and they used this to model as to what would be the expectations in 2040. And the number of people diagnosed with or dying from liver cancer would be increased by more than 55%. Between the next 20 years from 2020 to 2040, if the current rates do not change. These were the incidence of liver cancer out of these GlobCan estimates. This was the estimates which were made in 2020. And if you look at India, India is in this group, which is less than 3% overall. And this is the mortality. Again, in India, the mortality would be less than 2.9% if you look at India. And the Estimated primary number of primary liver cancer cases and the deaths were from India. Total were reported were 1380004, which is about 17% of the world total. The epidemiology of HCC is evolving, and the trends show that it's going to go up higher. In the high incidence areas, it's going to go down, while the traditional areas where the incidence has been high, it's going to increase. Low, it's going to increase. And some of the reasons for this changing epidemiology is there's an impact of newborn HPV vaccination, this treatment of HCV, and the changing lifestyle and the higher prevalence of metabolic syndrome. There's reduction in aflatoxin exposure because modification of post-harvest techniques. Various countries are divided on the basis of the Human Development Index. And if you look at India, India is coming in the medium HDI group of countries. And the overall projection of cancers in the next 20 years, if you look at this orange one, this is where we are. We are going to go up by about 64% in the medium HDI. This is the projected overall number of new cases of cancer overall combined. If we look at the liver cancers per se, these are the number of cases on the left-hand side, and these are the number of deaths on the right-hand side. And since we are medium HDI, we would expect about plus 69,000 new cases every year and about 65,000 deaths every year. This is the projected increase in cases per year. Some of the factors which would affect the prevalence of HCC in India would be HPV, which is declining over time. There is improvement in injection habits, transfusion safety, and lots of people, lots of young children, 84% have received the 3 doses of hepatitis B vaccine, which is very close to the target of 85% of HPV elimination by 2030. The increasing availability of DAA has decreased the prevalence of HCC. Alcohol abuse is changing, and that is going to replace HBV as a dominant cause, along with non-alcoholic fatty liver disease because of increasing BMI and increasing diabetes. These are WHO data, which is showing us the changes in death rates in HCC overall, as well as BC and alcohol-related liver cancers. See, if you look at this was year 2000 in blue and 2016 was green. So the overall liver cancers have gone up from 15 to 23% per 10 to the power 6 population. And similarly, there has been an increase in HBV, HCV, and alcohol-related liver cancer as well. If you look at the current etiologies of HCC in India, this was a study which came in 2008 by Kumar et al. The underlying cirrhosis was seen in 60%, and hepatitis B was the most common etiology in 73%. In 2008, it made 73%. This was another paper in 2013. The prevalence here is 60%. Subsequently, it's slightly lower. Again, this was a data which of 2012, where almost 68% were hepatitis B related. And this is a recent study, which is a multi-center study from 11 centers, which includes ILBS from Vellore, Chandigarh, Bangalore, so multi-center, and Mumbai. So all multiple center studies. They had 2,664 cases. The males were 83%, and the age of 64% of these were 50 to 70 years of age, with 20% being less than 50 years of age. 1/3 were diabetic. But you look at the etiology here, hepatocellular carcinoma with NFLD being 35%. B has come down to 21%, where earlier studies it was almost 60%. C is down to 18% and alcohol to 13.9%. A little under 1/3 to 1/4 people had no cirrhosis. In hepatitis B, 25% did not have cirrhosis, and hepatitis C, 23% did not have cirrhosis. This is data which is this is an article which is under review. If you look at the etiological factors, and again, you see that fatty liver is the highest percentage of cases here, and B and C are 21, 18, and alcohol is 13%. And some people had combined alcohol and viral as well. If you compare the cirrhotic versus non-cirrhotic cases, in non-cirrhotic, these were the percentages. HCC in hepatitis B about 20%, in C about 15%. So the etiological spectrum of cirrhosis have varied along in multiple different geographical populations. And this study has shown that, in contrast, hepatitis B and C is much lower than it was in previously and in other studies. And then NAFLD is becoming the most common etiological factor. To conclude, ladies and gentlemen, the incidence of hepatocellular carcinoma is increasing in India. The major risk factors for development of HCC appear to be in transition. Hepatitis B and C are declining, and NASH is poised to become the leading cause of hepatocellular carcinoma. However, to have good data, we need prospectively designed multi-center studies and population-based studies, without which data can only be skewed. Thank you.